So good morning friends. So today we will discuss the previous year questions. So first it is the role played by MHC 1 and 2 is 2. So here the options are stimulate the interleukin production, immunoglobulin class switchover, and transduce the signal to T cell following an antigen binding. And the fourth option is presenting the antigen for the recognition by T cell antigen binding receptor. Always remember, major histocompatibility complex is mainly for presenting the antigen to the TCR. Okay, that is a T cell receptor. Okay, so the major function of the MHC 1 and 2 is to present the peptide antigen to the T cell receptor. Okay, so here the answer is option D. So coming for second question, all are true about penicillin binding protein except. So penicillin binding protein is located in the outer cell wall. It is essential for cell wall synthesis. It acts as carboxypeptidase and transpeptidase, and it is an alteration in the penicillin binding protein is basis for MRSA. Yeah. So what's the false statement here? It is an A. Okay, because it is located in the not cell wall, it is located in the cell membrane. And second point, yeah, it is essential for the the carboxypeptidase and transpeptidase. So it usually acts as the key factor. And third point, here D option is, yeah, the alteration in penicillin binding protein, right? That is an you all remember like PB2 to PB penicillin binding protein 2A, it is mainly by the McKay gene. Okay. So next, inverted free tree appearance is characteristics of Bacillus anthracis, Haemophilus influenzae, Yersinia pestis, and Brucella. Yeah, it is a Bacillus anthrax. So what are the some of the culture agent here you won't remember is, so one, there will be a chain of bacilli. In gram staining, it will be having a bamboo stick appearance, and in agar plate, if you are seeing the culture under the microscope, it will be like medusa head appearance, and gelatin stab usually shows an inverted Fitri appearance, and solid media with penicillin, it shows a sting of pearl appearance. Okay, so you want to remember all the appearances of the Bacillus anthracis. So next, a male patient presented with a left mid-thigh crushed injury, which is a most essential step to prevent the gas gangrene in this patient. Wound debridement, anti-gas gangrene serum, and anti-tetanus or hyperbaric. Yeah, it is a wound debridement. Okay, so whatever, if there is any surgical debridement, it is an only important step to prevent the gas gangrene. Okay, so early surgical debridement is the most crucial step in the management of the gas gangrene to remove all the devitalized tissues, so as to remove the conditions that causes an anaerobic condition for the bacteria to be producing a gas gangrene. Okay, so always remember, whenever there is a crushed injury, the first step it is a wound debridement. So next, in patient with listeria meningitis who is allergic for penicillin, what is the treatment of choice? Yeah, it is nothing but usually drug of choice is ampicillin. If the patient is allergic to ampicillin, you can go for trimethoprim and sulfamethoxazole. Okay, so drug of choice for the listeria, it is an ampicillin, also it can be penicillin. So alternative, it can be given to cotrimoxazole if the patient is usually allergic for penicillin, but the cephalosporin is not effective. Okay, so these are the previous year questions. See friends, always remember, there will be some clue in the questions. You want to pick up the clue. For that, you want to practice as many as previous year questions and the MCQs. Okay. Thank you friends.